Hello, everybody. My name's Fran Garrigan, and I am the AMR Programmes Lead for the CPA. Today, we're going to talk about our SPARC programme and our point prevalence survey. These are the learning objectives for today's session. By the end of this training session, you will have or be able to explain what is meant by the term point prevalence survey, understand the importance of undertaking a point prevalence survey locally, nationally and globally. Describe the process for undertaking point prevalence surveys at your local facility, including preparation, data collection, analysis, and troubleshooting. We will then look at applying the PPS principles to local data collection and think about how we review your PPS data. Finally, we will look at developing smart objectives related to AMS interventions based on your PPS data. So let's start off with the why, the what, the when, and the who about our SPARC point prevalence survey. So why is point prevalence surveys important globally? Globally, point prevalence surveys can be used to assist the combating of antimicrobial resistance. They can improve antimicrobial use for better patient health. They can lead to sustained awareness on antimicrobial resistance and also can be used for research to create a reference database at an international level. So why is point prevalence surveys important to us nationally? We can get meaningful comparisons of antimicrobial consumption data. If there are more than 3 sites doing a global point prevalence survey, we can get country averages. We can also compare countries to others in the region. And again, this helps with research, leading to an in-depth interpretation of antimicrobial consumption data at different levels in the country. So why is point prevalence surveys important locally? We really need to use data for action. We can use them to evaluate prescribing practices and give timely access to the data. The facilities are encouraged to work with their own data and really use this to identify targets to improve prescribing in your own hospitals. We can then design local interventions to promote prudent prescribing of antimicrobials. Repeat point prevalence surveys can give longitudinal results, and we can compare local results to average results for the country if there are more than 3 sites within your country. So we've just looked at why we are doing our point prevalence surveys in the SPARC programme. We'll move on to what. So what is a point prevalence survey? A point prevalence survey is a collection of data used to identify the number of people with a disease or a condition at a specific point in time. It gives us a snapshot of clinical practice at a particular time. And we can see that it's a validated method for measuring the quality of prescribing and is an important part of antimicrobial stewardship programmes. It can give us key information about local practice. For example, the main antimicrobials in use, the percentage of prescribing of intravenous or oral antibiotics, and the indications that are commonly being treated locally. It can highlight areas for improvement and provides a tool to facilitate the discussion with prescribers and senior leadership teams within your hospitals. So looking at what is our SPARC point prevalence survey, the Commonwealth Pharmacist team really had to think about which methodology was most appropriate for our SPARC survey. We commonly work with the Global Point Prevalence Survey group, who are based in Belgium, and we've used this data tool for previous point prevalence survey in our projects. However, when we discussed this with our local and our key stakeholders for the SPARC programme, people were very keen to use the World Health Organization methodology. The really good thing about the Global Point Prevalence Survey is it gives you an analysis of the data, and the World Health Organization methodology doesn't give this, so sites have to analyse their own individual data. So we talked to the Global Point Prevalence team and really thought about actually, what is it that the World Health Organization data collection and methodology has that isn't included in the Global Point Prevalence Survey? And we were able to then adapt the Global Point Prevalence Survey to incorporate some of the elements that were in the WHO methodology and put those into the Global Point Prevalence. So this, with a little bit of magic, we then came up with our SPARC Point Prevalence Survey. So that's the what. What is a SPARC PPS survey? Let's move on to the when. So when is the best day to conduct a point prevalence survey? A weekday is the best day, so not during the weekend and not during the holidays. And if you're evaluating a surgical department, they shouldn't be surveyed just after a weekend or a holiday. Surgical prophylaxis data should be collected retrospectively. Each ward needs to be surveyed once on a single day in order to calculate the denominator correctly. But different wards can be surveyed on different days, preferably, but not necessarily within 1 month. So that's the when. Really need to work to your facility specific timelines and think about when is the best time for you to collect data at your facility. Let's move on to the who. So really need to think about who your team are that are going to be collecting your point prevalence survey data. Identify your team and a site lead. The lead will be responsible for planning and coordination, and they'll be supported by a multidisciplinary team. And if possible, this should include some infection experts if available. Really need to agree appropriate and realistic timeframes with your team and ensure your team are adequately trained and also have time to carry out a point prevalence survey. So that's the who. So just in summary, we've covered why we should do a point prevalence survey and why it's important globally, nationally, and locally, and individual patient benefits that it brings. We've covered what a point prevalence survey is. We've covered when to do a point prevalence survey. And we've also covered the team who should do the point prevalence survey. And really, our SPARC point prevalence survey data collection is just the beginning of the process. From the data collection, we move to data analysis. And as I said earlier, this data analysis is provided by the Global Point Prevalence Survey team after you've validated your data. So we get that data analysis back, and then it's really important that you share the data within your facility and ensure that the hospital leadership teams, down to the individual prescribers, are aware of that data. And then together, use the data locally to develop interventions. And then share those interventions and your successes widely and celebrate your successes. And then go back to the start of the cycle again and move towards data collection to really evaluate whether your local interventions have impacted on your prescribing. So what are the benefits of doing a SPARC adapted point prevalence survey? It gives us feasible and achievable surveillance. It's a simple standardized protocol, and it's a web-based tool for data entry and validation. It gives us a quality assurance approach and with the data validated. We have central support from the Global Point Prevalence team. There's a help desk, there's a frequently asked questions, and there's an IT manual. It gives us a tool for assessing interventions to improve antimicrobial prescribing when we repeat those point prevalence surveys. Our results and our methodology provides consistency and reproducibility, and it enables feedback of results to each site. So how do you prepare to carry out a point prevalence survey at your facility? Preparation is key. This slide shows an adapted step-by-step guide for setting up a healthcare facility point prevalence survey from the World Health Organization. And it identifies step-by-step, thinking about structures and governance. So as we said before, identifying your team and really ensuring that everyone's aware of it. Defining your objectives and methodology. And we've done this bit for you by using the Global Point Prevalence Survey tool. Think about preparation. And think about ethical approval, and think about the days on which you are going to carry out the survey. And prepare the materials that you require. Then move on to data collection and validation. If possible, can you do a pilot survey? So get your team together and go to a ward and really think about how you're going to collect the data and how it works. And then we move on to data analysis and reporting. So really getting the data that's fed back from the global point prevalence team and reporting it within your hospitals and making those interventions and monitoring and evaluating the interventions that you make. So this is a slide from the Global Point Prevalence Survey's website, and it's just to reassure you about data confidentiality principles for doing the Global Point Prevalence Survey. So the patient level data entry is anonymous, and data is strictly confidential and is safely stored on a secured server at the University of Antwerp in Belgium. The hospital in itself builds up and remains the owner of its own database, and data sharing is only done after explicit and written approval from the hospital. Names of hospitals are never revealed in scientific publications or reports without that approval. And the Global Point Prevalence Survey do have a data privacy excerpt and a publication policy, which we can provide for you if you need them. So ethical approval, it does depend on the country and the setting. And again, we can use the Global Point Prevalence data privacy for this. You don't need informed consent from patients, as global PPS is considered a retrospective audit. So materials to help you conduct the survey are available online, and these include translated protocols and data collection forms, frequently asked questions lists, your IT manual and tutorial videos, a list of our antimicrobials with the ATC codes, and PowerPoint slides on the methodology. So if you need any extra materials, then visit the Global PPS site. Communication at a facility level is key. It's really important that your hospital leadership team are aware of the project and the timeframes. It's really important that your ward teams are aware that the project is happening and when it's going to be done in their area. If you ensure that the ward teams are aware of the day that you're collecting the data, then they can hopefully help with ensuring that patient notes and drug charts are available to really increase the efficiency of your data collection teams. It's important to communicate the fact that you're doing a local PPS with your prescribers and make this a positive endeavour. It shouldn't be seen as a critique of individual prescribers prescribing antimicrobials. It really should be seen as a positive audit that's going to be done to improve the use of antimicrobials across your facility. You need to make sure that your team are aware of what data they should be collecting and that they know how to collect the data and have been appropriately trained. Because unfortunately, if you put rubbish data in, you get rubbish data out. So not doing the PPS properly and not putting the right data in will give you really poor data that you don't have much to do with. And carrying out a PPS in your facility is time consuming. So it's important that you put that good data into the system to get the best data out of it so you can design your local interventions. Your data should be useful to you. You should be able to use it, and we should use it. So data should be useful, usable, and used within your facilities. This isn't about having too much access to data and data overload. It's really about trying to make your data useful to your facility and to try and guide your antimicrobial stewardship interventions. So troubleshooting, what resources are available to you? So the SPARC site champion should have PPS resources, and these will include the frequently asked questions list and the training resources. Your SPARC in-country champion should also have access to these. And there is a SPARC PPS support email as well that you can email while you're doing the PPS for any on-site immediate support that you might need from the team. So we've covered data collection. I've told you that the global PPS team will do the data analysis. How do we use our data for action? So now what do we do when we've collected the data and we've analysed it? What shall we do next? It's really important, as I've said, to effectively communicate your results. The data from the PPS will be available on an individual facility level. And it's really important to ensure that feedback is given to the right people in a timely manner. So as I said, from your hospital management team down to your individual clinicians and anyone who's involved in antimicrobial stewardship. Really, it's a great opportunity to create awareness of antimicrobial stewardship and antimicrobial resistance, and really increase the ownership of your data and your antimicrobial stewardship activities. And using this data, as I've said, to develop our local AMS interventions. So the World Health Organization have a really good toolkit on how to develop AMS interventions. And this is a really great tool for your facilities to look at and use. And we would strongly advocate the use of this toolkit. And this is just a little bit of a clip from this toolkit. The key message about AMS interventions is that they should be implemented in a stepwise approach, building on existing structures, reporting, really maximizing your teamwork, encouraging your clinical staff to be champions for antimicrobial stewardship. And don't try to do too much. Start small and keep it simple and doable. And this is how you will have success in developing these key interventions. So this again is from the World Health Organization toolkit, and it's just looking at your questions to address when applying quality improvement to your AMS interventions. What are you trying to achieve? Set a goal for your change that is SMART, so specific, measurable, achievable, relevant, and time-bound. Really think about how will you know that the change is an improvement. So determine the quantitative measures that you are going to use to show improvement. And then think about what changes can you make that will result in improvement. And acknowledge that not all changes will be an improvement, but think about behavior change and the behavior changes that will result in an improvement. So just going through how to develop AMS interventions. Our PDSA cycle for continuous quality improvement really helps us to do this. So preparing, we should be identifying our leadership and our team, and study your data that you get back from the Global Point Prevalence Survey. Think about your quality indicators that are introduced. For example, your number of antibiotic prescriptions with a documented stop or review date. So really think about what is it that you want to change. Again, as I've said, set those SMART goals. Really make your goals specific, measurable, achievable, realistic, and timely. So set, for example, by June 2020, 90% of the antibiotic prescriptions should have a documented stop or review date within your facility. That's a potential thing goal that you could set. So there we have something that is specific, it is measurable. Hopefully it's achievable. If not, then maybe you need to set a lower limit. It's realistic and it's timely. So plan your SMART interventions to reach your goal. So how are you going to achieve this? For example, are you going to use education? Are you going to do workshops? Think about the policies that you might need to implement and your communication plans. And then we reach the do bit of the cycle. So then you're going to implement those interventions. You're then going to move on to study those interventions. So by performing, hopefully, repeat point prevalence surveys or smaller audits, and then really adjust if needed and go back to this stage of the cycle. So in summary, what we've covered today we've looked at the benefits of conducting surveillance through our SPARC point prevalence survey. We thought about designing stewardship interventions to promote prudent antimicrobial use and improve our patients' health. We've identified targets to improve antimicrobial prescribing and also prevent healthcare-associated infections. And we've thought about assessing the effectiveness of interventions through repeated PPS studies. We've tried to think about raising awareness on antimicrobial prescribing, and really one of the focuses of this, it's not just about data collection. This is about improving the care of our patients and raising awareness of antimicrobial stewardship. So thank you for listening today to this talk, and I really wish you luck in carrying out PPS in your facility. If you wish to practice doing the point prevalence survey before you actually carry it out, we have some access to case studies within our training materials that are available. So please do have a look at these and think about how you can practice completing the forms. Thank you very much and good luck.